Hello, and thank you for joining us. I'm Sandy Potter here again with Masonicare President and CEO, JP Benoit, our Senior Director for Continuum Health Services, Dr. Ronald Schwartz, and Sierra Drevlin, Director of Employee Health Services for Masonicare. Welcome back to you all. Dr. Schwartz, last Friday, the CDC announced that it is relaxing its indoor masking guidance for communities where the risk level is considered to be low or medium. Can you bring us up to date on the specifics of that announcement?
Well, I can certainly try, Sandy. And once again, we have a nice article that I'm going to present to you. And again, these articles are pretty long. So as you know, I try to condense them, and there's some quotes as well from different experts. So let's get started. So the title of this article is CDC says Americans can now go unmasked in many parts of the country. So I'm going to read this to you, and it starts, the Centers for Disease Control and Prevention announced Friday it is relaxing its mask guidance for communities where hospitals aren't under high strain. Under the new guidance, nearly 70% of the US population lives in an area considered to be low or medium risk, and residents there are advised they can go indoors without masks. But they do say the CDC recommends continued mask use in communities where serious cases of COVID-19 are straining the health system. The move to ease up on masking, federal officials say, reflects current conditions at this phase of the coronavirus pandemic, including widespread immunity through vaccination and prior infection, as well as better access to teaching, to testing and treatments. Health officials emphasize that people should still wear face coverings if they wish to, or if they're personally at high risk. And regardless of local conditions, they should mask if they have COVID-19 symptoms or a positive test or have been exposed to someone with COVID-19. So that remains important. As part of the change, the CDC is actually dropping its recommendation for universal school masking, and instead will recommend masking only in communities at a high level of risk. Though cases are rapidly declining in the country, currently around 95% of counties are still seeing those substantial or high levels of spread, according to the CDC's older risk metrics, which were based primarily on new cases. So now we're going to talk about the new metrics. And under the CDC's new metrics, which it's calling COVID-19 community levels, an area is deemed high risk if it has concerning levels of COVID-19 hospital admissions and hospital capacity taken up by COVID-19 patients. About 38% of US counties are in this new high risk category where mask wearing is recommended, but these counties account for only 28% of the population. And many public health experts say the shift in guidance makes sense in the context of declining case rates and the widespread availability of COVID-19 vaccines. So this is actually a quote from Dr. Ali Khan. He's a former CDC official. He's now the dean of the University of Nebraska. And he says, I think we're moving to a pragmatic strategy, one that recognizes that those who want to protect themselves have every tool available. There are free vaccines, free masks, free tests, and free antivirals. And he goes on to say that it's now up to communities and individuals to determine what actions to take to protect themselves and those around them. So finally, he says it makes sense for the CDC to put in place shared metrics for understanding risk, and then locally for communities to make decisions to relax mask guidelines based on what the local conditions are, how well people are vaccinated, how many people are going to hospitals, what sort of absenteeism levels you have among hospital staff. So this is another comment. On the other hand, the new risk metrics, which now include a combination of case levels, hospitalizations, and hospital capacity, are not easy to understand. This is a comment from Dr. David Dowdy. He's an epidemiologist at Johns Hopkins University. And he says, this is a quote from him, I'm always a little concerned when guidance gets more complicated rather than simpler. I understand the desire to incorporate both cases and hospital admissions and maybe even staffed hospital beds, but trying to come up with a formula like this risks making it difficult for people to actually implement this guidance in a real-time fashion. So that's a lot of information, and this is I'm sure going to be ongoing, and we'll continue to update you as we get more and more information. So let me now try to give a nice positive quote for the week. Never let the fear of striking out keep you from playing the game. You know who said that? Babe Ruth said that. So it's true. You know, we just have to keep, what's the word, staying in the game, doing our best, trying to work together. And, you know, we continue to make progress, and it is more and more encouraging every day. So I always say thank you for everything you do, and I wish everybody health, and I always wish you peace. Thank you.
Thank you so much, Dr. Schwartz, as always, for breaking that down. And Sierra, the CDC actually has put together a website to help track the community data, and folks can go there to see the latest information for where they live or for where they might be traveling to. Can you walk us through how we can access that?
Absolutely, I'll be happy to. So the CDC website has a plethora of web pages to help individuals. And I will point out that you have separate community and healthcare guidance. So one thing to note is, depending on your audience, you'll have to look in a different place. But this one is fairly straightforward. So I am on the web page entitled COVID-19 Community Levels. And it's helpful to bookmark this because based on the cases in your county, your levels may change. And it's very helpful to know weekly or monthly to give it a look to see what's happening and what the mask recommendations are. And again, this is not for healthcare. So on this site, you have a breakdown of every county in the United States, and you can drill down to see your state and the surrounding counties in the area. And fortunately, Connecticut is mostly in that low category. So that is very helpful. And with the low recommendations comes, you know, the choice to mask based on your immunocompromised status and your comfort level. So hopefully we'll stay in the low category for a while. And I just wanted to also mention what we're using for healthcare. So a lot of confusion, I think, is around, you know, different rules for masking, because as healthcare workers, we have, you know, children in public schools and they're unmasking. And for healthcare, we continue to use the community transmission levels, which is new cases in the last 7 days per 100,000 population. And that metric is used and referenced in the Centers for Medicaid and Medicare Services, and also in the CDC guidance on infection prevention and control. So that's an important metric that we will continue to use. I know that the media likes to use positivity because it's something that is very easy to understand, positive tests, and you know, out of all the tests performed, how many were positive. But we will continue to use the community transmission based on county, and we are still insubstantial in New Haven County. So there is a little difference there between the two metrics, and I think it's important to continue to look at both of them as a healthcare worker, and hopefully that was helpful. Thank you.
Yes, thank you so much. It's really wonderful to have you on top of that for us here at Masonicare. And finally, JP, how are we responding at Masonicare to this latest guidance on masking?
So Sandy, today's actually our 2-year anniversary of starting the Corona task force. And I was actually looking back at old emails and communications. And if you think about it, 2 years ago, we were in the start of really not knowing what was coming down, but preparing for potentially the worst. And when I looked at some of the emails, if you remember the first few months, we were worrying about, should we be sewing masks and making masks, and having enough masks to, you know, today, there's plenty of masks out there. And as we continue to see this virus evolve and how we've combated it, the mask usage is changing. And I think it'll continue to change. And at Masonicare, that Corona task force that was established 2 years ago is really keeping a close eye on all of our communities on what we will be doing. And in some areas, we will start to see some loosening based on, what Sierra said. And in some areas, we will continue to wear masks pretty much for quite some time. There are some restrictions that are set forth by the state and federal government that won't allow us to loosen up the masks until they say so. But we're paying very close attention to it. I thought this was also a good time for our 2-year anniversary to as always, thank all of our staff. It has been an emotional roller coaster for all of us, and I can't tell you how proud I am of our staff, of everything that they've done. Our residents who, have endured 2 years of pretty difficult times, and I wanted to thank them, and obviously the families for being there for us and understanding what we have been able to do for their loved ones. We are Masonicare strong, and I will tell you, these 2 years have made us stronger together, and I look forward to getting ourselves to even more normalcy as we move forward. So thank you.
So wonderfully said. Yes, absolutely. Thank you so much. And thanks to all of you for sharing your time and insights with us today, as always. And thank you for joining us at home once again. Until we see you next time, we hope you stay well and stay safe.